Hi, I'm Bill Pierce, Senior Director at APCO Worldwide's healthcare practice in Washington, D.C. And here are three things we learned from the testimony of Alex Azar, who's been nominated to be the next HHS Secretary. But first, a disclosure. I worked with Alex at HHS when he was there as General Counsel and Deputy Secretary, and have known him ever since. Here are the three things we learned. Number one, he's going to set a different tone than his predecessor at HHS. Even if you disagree with his policy, he wants to work with you. He wants to try to work with you. He made that clear to the U.S. Senators at the committee, and he's made that clear throughout. Number two, despite his clear competence to do the job, he's been a senior executive in corporate America. He essentially ran HHS when he was there as the Deputy Secretary. He's likely to get few Democratic votes, even though they're willing to work with him. It's just a different era we're in now. Contrast that to when he previously worked at HHS as first General Counsel and then Deputy Secretary. He was twice confirmed unanimously, but it's a different time. Number three, Alex Azar has a clear agenda for being Secretary of the Department of Health and Human Services. Number one, he's said drug prices are too high and he wants to work on it. He wants to tighten up patents and exclusivity, stop gamesmanship, and he wants to work on making drugs more competitive both within brand and between brand and generic. Number two, he wants to make healthcare more affordable. And it's not just premiums, it's actually the cost of healthcare, and to use the government authorities to try to perhaps move us in that direction. Number three, the opioid crisis. Certainly something on everybody's mind and something he wants to be very involved in and thinks is extremely important. And number four, moving Medicare from volume to value. It's a huge process that's already started, but he wants to move it along quicker and make it a reality.